given to Jennifer Krieger and my staff to do a walkthrough of House Resolution 32.
Well, I drew the short straw and spent the last 2 weeks of my life reading this lovely bill. So I want to give you a brief, objective summary of what's in here. It's going to be impossible for me to cover everything that these 1,017 pages contain in 5 or 10 minutes. So I just want you to be clear that there are things that I'm not going to talk about, but I'm going to try to give you the broadest overview of what's in it as it was written. The bill first creates new standards for health insurance coverage in the country. Some of those include a prohibition on exclusion for pre-existing conditions, guaranteed issue of insurance coverage, and limitations on premium rates. The bill defines what the government will consider to be an essential benefits package. So that's a list of services that will be covered and the requirements that insurance companies will have to meet. And those essential benefits will be recommended by a new government-created Health Benefits Advisory Committee. It also gives private plans up to 5 years to comply with these new requirements. Probably the first thing and biggest thing in the news is the new creation of the Health Insurance Exchange. So this will be a list of plans in the country that are approved by the government. That will include a public option. Plans, as I said, will need to be qualified health plans to be in the exchange, and all health insurance plans will need to be part of this within 5 years. The bill does create affordability credits that can go both for premiums and cost sharing. Those affordability credits will be available to individuals in the United States with family incomes less than 400% of the federal poverty level. So that averages out to a family income of $88,200 will be eligible to receive government subsidies to qualify for these affordability credits. They also cannot be eligible for Medicaid to get those. The commissioner of the exchange will be able to access tax returns to determine if an individual is eligible for these affordability credits. On the employer side, employers are required to offer coverage and they must make a contribution toward coverage, even if an employee declines an employer-provided coverage. The employer must contribute a minimum of 72.5% of the premium for individuals or 65% of the premium for families for their full-time employees. The bill does provide for penalties for small businesses who choose not to provide coverage. You may have heard about this. This starts at $250,000 of gross annual payroll. If you have a payroll at $250,000 and choose not to provide coverage, you'll be assessed a 2% penalty on that payroll, and that will go up to an 8% penalty. It's kind of a sliding scale based on the amount of your payroll, but the biggest is 8% for a $400,000 payroll. There is a tax on individuals of 2.5% of their gross income if you do not obtain any kind of health insurance coverage. They do provide for tax credits for small businesses with 10 employees or less to provide coverage, and the amount of that tax credit is 50% of the amount you pay for coverage. There's a tax provided for high-income individuals, a sliding scale starting at $350,000 for married income. That's a 1% tax, and then going up to a 5.4% tax. And that can increase to 2 to 3% if the funds that the government received are not sufficient to fund this program. If the program does generate savings of greater than $175 billion, there will be no taxes. There are a number of changes to Medicare and Medicaid. Skilled nursing facilities, rehabilitation facilities, and home health will have their funding increases frozen. So that amounts to a cut for them. And those facilities and some additional ones, emergency care, lab services, will have a productivity assessment added to their future rate setting. There is a fix to the payment rate for physician reimbursement under Medicare. Some of you may be familiar with that. There are rate reductions for ambulance service, lab service, ambulatory surgical centers, and durable medical equipment under Medicare. It makes significant reductions to the Medicare Advantage plan. There is a gradual elimination of the donut hole under Medicare Part D. CBO has estimated that change could increase Part D premiums by 5% in 2011, but they also say that it could reduce overall drug spending as well. The asset limits to qualify for the Part D low income subsidy and the Medicare savings plan are increased, but the bill allows a person applying for the low income subsidy to self-certify their income and resources. And there's a study on Medicare reimbursement for competent language and translation services for beneficiaries who have limited English proficiency. There are a number of incentives and bonus payments for innovations into primary care. There's a medical home pilot program created to study the effect of coordinating care. All Medicare preventative services would have their copays and deductibles waived under the bill, and therapy and counselor services would be covered under Medicare. There is a Center for Comparative Effectiveness Research created, and that's another government panel to determine how health conditions will best be diagnosed and treated and managed clinically in the country. There are a number of new requirements for nursing homes and regulations for them. There's a physician payment sunshine provision that requires drug manufacturers and distributors to report any gift or transfer of value over $5 to physicians. So pens or trips to Bermuda. There's a fairly large expansion of Medicaid eligibility. It says that Medicaid will cover 100% of non-disabled childless adults up to 33% of the federal poverty level. That's approximately $28,000 annual income. Currently, Medicaid is a split between the federal government and the state government, so that's a fairly large additional federal expenditure covering 100% of that breakdown. And Medicaid will cover all preventative services going forward, and they are allowed to cover family planning services. Again, they authorize the IRS to disclose tax return information to the Social Security Administration to allow them to determine if people are eligible for low-income subsidies. And there is a insurance per insured individual calculated by a specific formula in the amount of $375 million. There is a great deal of additional money for public health priorities, including community health centers, primary care programs, nursing and public health workforce programs, and money for diversity training and cultural and literary competency. There's a new prevention and wellness trust fund that's $35 million expenditure over 10 years, which establishes a national prevention and wellness strategy. The Congressional Budget Office estimates that the bill in its current form would increase the federal budget deficit by $239 billion over the next 10 years. And the projected costs in this bill over 10 years are $1.042 trillion. The revenue provisions in the bill are expected to come in at $802 billion. So that's the brief overview for you.